MUSC is extremely well prepared from the leadership level down. And that's apparent if you look on MUSC's webpage, right? So there's a ton of information already from leadership for our patients and employees. From our division, we have a coronavirus working group, and we've put together a training module for healthcare workers with regard to identifying patients under investigation and correctly identifying personal protective equipment and how to correctly obtain specimens, et cetera, so forth and so on. MUSC is very prepared. Also from the telehealth perspective, we're working on that platform. Telehealth is a extremely logical solution to a public health concern like this. We're talking about a highly communicable disease. It's highly transmissible. And particularly when you have a group of people that are susceptible with a few infected people, like say in an ER, there's going to be a high rate of transmission. So R0 is a number that we use when we talk about the transmissibility of infectious agents. It doesn't necessarily tell you how severe or pathogenic something is, but it gives you an idea of technically the number of secondary cases that would be produced by one infective person to a crowd of susceptible people. So a perfect example is measles. Measles has a very high R0, it's like 16, right? So one infected person in a sea of susceptible people can be expected to infect or to cause 16 secondary cases. So that's a big deal when you're talking about doing mathematical modeling and projecting an epi-curve. For, say, coronavirus right now, that number continues to change, right? Because it's a dynamic scenario, and those calculations are continue to fluctuate a little bit, but it's somewhere between 2 and 4 is what it appears to be right now. The beauty of telehealth and all of these telehealth platforms is that we can remove that element of transmissibility through close contact, which is defined as less than 6 feet, by seeing to patients remotely. And patients can be in the comfort of their own home, I can be in my office. I think encouraging people to use these telehealth platforms, keeping them out of the ER is extremely important. But that's a great way to be seen if you don't have a primary care provider and get medical attention if you have a mild upper respiratory illness.